панове, дорогі колеги! Тиждень ВЕН – захоплююча подія з форматом проведення, що дозволяє об'єднати флебологів, ангіологів та судинних хірургів з усього світу. Ми маємо можливість поділитися новою інформацією, впроваджувати уніфіковані підходи в лікуванні таких поширюваних захворювань, якими є захворюваннями вен і лімфатичних судин. Такі зустрічі сприяють нашому об'єднанню як професіоналів, так і друзів, створюючи передумови для розвитку флебології без кордонів. Насолоджуйтесь активною участю, любі колеги!
Здравейте, колеги! Честотата на венозните и лимфните заболявания расте непрекъснато в цял свят. Напредък в профилактиката и лечението се получава при дискусия и обмяна на опит на експерти и специалисти от света. Такава дискусия ще се проведе през април по време на венозната седмица. Бъдете с нас!
A doença venosa crónica, a doença tromboembólica venosa e a doença linfática são, como todos nós conhecemos, muito prevalentes à escala mundial. E são também, infelizmente, frequentemente subestimadas pelos doentes, pelos seus médicos assistentes, pelos mídia, pela opinião pública e, inclusive, por nós, especialistas na área. Importa combater esta realidade. Importa mais precocemente efetuar o diagnóstico correto e mais atempadamente iniciar o tratamento adequado, uma vez que estas patologias têm um impacto significativo na qualidade de vida do cotidiano destes nossos doentes. Vamos todos juntos combater este fenómeno. Vamos todos juntos participar numa iniciativa que vai decorrer à escala mundial de 5 a 11 de abril, na Vein Week. Junte-se a nós!
După cum știți, patologia flebolimfatică este mai puțin cunoscută și, în consecință, bolile venoase și limfatice sunt subdiagnosticate sau eronat diagnosticate. Săptămâna Sănătății, 5-11 aprilie, o dedicăm acestei patologii pe plan mondial. Vă invităm să participați alături de noi și vă așteptăm cu drag la Vein Week.
Bonjour à toutes et à tous. Du 5 au 11 avril prochain aura lieu au niveau international la Vein Week. C'est un honneur pour moi de présenter la semaine de la veine. La maladie veineuse et la maladie lymphatique sont des maladies complexes qui ont souvent été ignorées. Elles affectent des millions de personnes dans le monde. Les femmes, aussi bien que les hommes et les enfants, en souffrent. Il existe aujourd'hui des méthodes sophistiquées pour bien les diagnostiquer et des traitements efficaces pour en enrayer l'évolution. Sans traitement, elles peuvent entraîner des complications. Soyez informés. Parlez-en à un phlébologue, un médecin spécialisé dans les maladies veineuses et lymphatiques, ou consultez la Société canadienne de phlébologie à sociétécanadienne-de-phlébologie.org si vous désirez de plus amples informations sur la prise en charge de ces maladies.
Vein Week. Дорогие друзья, уважаемые коллеги, 7 апреля под эгидой Всемирной организации здравоохранения отмечается Всемирный день здоровья. Заболевания вен крайне широко распространены во всем мире, а осложнения, связанные с ними, носят миллионы жизней. Поэтому врачи всех специальностей, молодые специалисты, студенты, все те, кто понимает о необходимости профилактики венозных заболеваний, должны знать основные аспекты этой проблемы. 5-11 апреля под эгидой Всемирной организации здравоохранения Weekend Foundation всех коллег со всего мира, со всех континентов мы проводим неделю Vein Week. Я приглашаю всех, те, кто интересуется проблемой заболеваний вен, поучаствовать в популяризации этой важнейшей проблемы всего мира. Приглашаю всех 5-11 апреля на Vein Week.
今私たちはコロナウイルスなど世界規模で取り組まなければいけない問題がたくさんあります。血栓症など静脈疾患への啓蒙活動もまた大切な取り組みです。ベインウィークの活動を通して市民の皆様の健康をサポートしていきます。
せーの。
ベインウィーク
It's April 6th, it's Tuesday, so it's time to say welcome, bienvenido, or benvenuti to the second day of the Vein Week, broadcasting in this case from Italy, focusing on the day dedicated indeed to the patients. As you might know, all the days are dedicated to different audiences, and today is a very special day because indeed we focus on what is the most important final mission of the patient, of course. We will have also on Friday and Saturday other two initiatives from Italy dedicated to multispecialty and social engagement. I'd like to take this chance to deeply thank all the ones who yesterday joined virtually Italy for the webinar dedicated to the health professionals. While today we really experiment something different, as I will tell you in a little while. Today we will enjoy once again a simultaneous translation in Italian, Spanish and English. Thus I recommend to choose the channel you prefer, and you will be able to make questions in whatever language in the question and answer box, but today, differently from the usual, we will use a lot also the chat, particularly for the faculty, because today we have also patients with us following who will be allowed to make questions to all the huge experts involved from all around the world in this webinar. Why creating this Vein Week initiative? Well, the answer I think is pretty easy if we look at the evidence-based data showing that we have significantly high potentials of encountering patients affected by venous and or lymphatic disease. Particularly if we consider then that venous disease is associated with venous thrombosis, leading a cause of preventable death. And as I said yesterday, I like to highlight the word preventable because indeed it is our responsibility as health professionals to interact at best with non-health professionals to prevent the condition. But it's also our responsibility to advocate for our patients who are hit not just by the pandemic of COVID in this day, but by also the epidemic, the hidden epidemic of the lymphedema, another condition extremely important. I think we usually don't consider that much is the psychological and sociological impact of these two conditions, for which we decided today to really experiment a different webinar. If we just have a brief look at the data that we have in the literature, we see in the venous ward of the advanced ulceration what kind of huge numbers we have in terms of depression in our patients. And as I was saying before, in the lymphedema ward, it is not a difference. If we look at the literature, we see that there are nice data pointing out how also lymphedema can have a really negative impact on the psychosocial life. But also the fact that there are lacking research on the topic because there is lacking awareness, very probably, for which, again, we are here today, and for which we are more than honored of having always as giant ambassadors, Professor Caprini for the vein ward and Professor Lee for the lymphatics. I'd like to deeply thank them together with the steering committee who made Vein Week possible from the very beginning of months ago when we started working together, also with more than 114 now developers involved all around the world. I'd like to deeply thank all of them for having created so many interesting initiatives. I really invite you to enjoy visiting the website. You can simply click in the region and find out all the brilliant initiatives that are now running around the world. This has been made possible through unrestricted grants of Alpha Sigma, Medi, and Philips, who I like to deeply thank for their unbiased support. As always, nothing would have been possible from the very beginning without Professor Bottini and Professor Chi, for which I will pass the mic now to Oscar if he's with us. I see you, so please, Oscar, go ahead.
Thank you. Dear all, welcome to this extraordinary initiative organized for this Tuesday of Vein Week, a special activity that connects the most relevant experts in the world with the general audience. Everybody will be enriched today. Let's enjoy this webinar.
Thank you so much, Professor Bottini. And now Professor Chiu is in clinical hours, so here is message.
Good morning, good afternoon, good evening. Today we have a great program on the psychosocial aspect of both lymphedema and venous ulcer. I hope you will enjoy. Thank you.
And we deeply thank Professor Chiu also for the brilliant lecture of yesterday. We are broadcasting from Italy, so we would love to introduce once again a special Italian colleague and friend who really demonstrated what real commitment and advocacy for venous and lymphatic disease means. So Paolo, here is your time to say benvenuti a tutti.
Buonasera a tutti i colleghi, grazie Oscar, grazie Willy e grazie soprattutto a Sergio che mi hai confermato in questa serata. Veramente sono molto contento, soprattutto perché oggi vengono coinvolti i pazienti, perché forse mai come il paziente flebopatico ha bisogno di un rapporto diretto e sincero con il proprio flebologo. E quindi sono molto interessato di vedere il rapporto, come nel mondo questo rapporto medico-paziente si sviluppi. Grazie a tutti e vi seguirò con molto interesse.
Thank you so much, Paolo. And now the international honorary chairs. We fly all the way to India. I've seen Professor Jindal connected, so let's see if he's able to say a word now. Raul, if you are with us.
Yeah. Thank you, Sergio, for inviting me. And I think this is a wonderful initiative. And I was going through all the programs, what all people are doing all over the world. It's fantastic. We had TV recordings today. We had one radio recording on the Vein Week, and it's going to be relayed tomorrow and day after. And Friday, we have got another program for the healthcare professionals. And I think the topic for today is also very interesting. We have never discussed this in the routine. And I think that would be, very, very good. And I really like to congratulate everyone who has participated. And I think this is really going to create a huge amount of awareness all across the world. Congratulations.
Thank you so much, and deeply thank to you, because indeed Professor Raul Jindal, talking also with the patients who are following us today, is one of our most eminent figures, and indeed has been also selected in the steering committee. So he has been working from the very first day 6 months ago. So thank you so much for keep on being such a wonderful example. A really wonderful example is also Ellie Lindsay, a person who needs no introduction in our health professionals world, but also in the non-health professionals world, because she's the founder of the Lindsay Leg Club, a model of co-work with also the patients that we should all follow around the world. Ellie, the mic is yours.
Thank you, Sergio. Firstly, I'd like to say a huge thank you for inviting the Leg Club Network to be involved in this fantastic... Sorry.
Yes, you can go on.
Oh, I'm so sorry. I heard a noise, that was all. It really is a fantastic initiative. My whole work is addressing the psychosocial issue of lower limb problems. And I truly believe, and I'm sure a lot of you will agree with me, that when you have a leg ulcer today, you never have a good day tomorrow. It's a big, big problem, and sadly, it's one that there's a lot of disparity and a lack of interest for governments. And so my whole mission is to get it raised publicly and become an advocate for those that need the expertise. Thank you.
Thank you so much, Ellie, and congratulations. If everyone wants to have a look at the UK, you will see so many dots. They are all amazing events created by the Leg Club. So congratulations for the massive effort and success. Another huge example we have in our venous and lymphatic ward is the one we define the Queen Pauline, because indeed she's one of our venous and lymphatic queens. So Pauline Raymond Martinbeau from the Canadian Society of Phlebology. I see Pauline is connected, so if you want to say a word. unmute yourself, Pauline, unmute yourself.
Hi, everyone. And thank you, Sergio, for the fresh cappuccino you sent me from Italy this morning. Thank you, Sergio and Oscar and Willie, for that great initiative and to giving me the opportunity to comment on that lymphedema is often seen as a minor complication of life. But for the ones that are living with it, it's another story. It can have a major impact on their quality of life and the one of their family, affecting both their physical and emotional well-being. It's important for them, for the treating physician and for the caregivers to communicate well and offer and explain all aspects of the needed care. This is our opportunity to join together as one, as we educate the world about the importance of treating venous lymphatic disease that affects millions of people, women as well as men. Let's discuss the impact these diseases have on everyone. Thank you.
Thank you so much, Pauline. And thank you to all the ones who will have some patience today, because indeed we are going to experiment an atypical form of webinar compared to the ones we are used to. Because rather than talking about just evidence-based science as we usually do, we try to interact also with the patients and also with the top professionals from what we usually don't consider that much from our vascular side, but that for sure we should consider more. So the way we conceived this webinar is this. In the previous weeks, thanks to the collaboration of wonderful colleagues from all around the world, we've recorded patients' interview, looking in this way at different perspectives of different patients from different angles of the world. Then we sent these interviews to top professionals, in particular Professor Dominic Upton from Derby University, Professor Anna Galatska from Cardiff University, and Professor Penny Upton from Canberra University, two psychologists and one sociologist. They then sent us back videos with their comments on these aspects that we are going to enjoy during the webinar. And then during the webinar, from the different continents, we will have vascular experts who will be at disposal of all the audience. I'd like to deeply thank once again all the ones among the vascular experts who recorded these patients' interview, and I'd like to deeply thank all the patients for advocating for health around the world. And again, I like to point out this is an atypical webinar, which means that rather than talking for the faculty, I really invite you to write in the chat, eventually also in your language, and eventually answer to eventual comments of other colleagues or of patients. And then we will also select some faculty members for coming live at the mic. At this point, we will start enjoying Professor Dominic Upton perspectives on the psychological impact of lymphedema. And then we will start the World Scientific Round with all the experts.
Good afternoon. My name is Dominic Upton and I'm from Charles Darwin University in Australia. This afternoon, I'm going to be talking about the psychological consequences or the psychosocial consequences of living with lymphedema. I'm starting from the diagnosis and going all the way through management and treatment, the stigma and the social consequences. So if we start with the diagnosis, we've got to remember that when a person gets given a diagnosis of lymphedema, it's not just a medical condition. It comes with a whole host of psychosocial consequences. And it's important to find out what these mean to the individual. How does the patient define their condition? How does it impact upon them economically, psychologically, socially, whether that be through family, friends, or organised groups? All of these come with a certain amount of uncertainty, and I think it's important that the medical or nursing professional appreciates these. Although a medical, nursing, podiatry, a physiotherapist, or other allied health profession may know some of the medical consequences of the conditions, they don't understand how it can impact upon an individual personally. The individual with the condition may be uncertain about the diagnosis, the term, what the actual symptoms mean, what the long-term prognosis is, how the treatment is going to impact upon their daily life, how the management of that occurs. Similarly, there might be what's known as trajectory uncertainty, the course of the condition and the outcome, whether it's going to be successfully treated or not. and symptomatic uncertainty. These short-term fluctuations are going to impact upon the individual. It's also important to realise or to appreciate that an individual patient or person living with a condition may experience stigma. And this stigma can come in one of two forms. It can be enacted stigma. This is a negative comments or discrimination from others, looking, pointing, making comments behind a person's back. Or it could be felt stigma. There may not be these negative comments or observations from others, but there might be a perception that there is. They may be feeling negative or negative consequence of this. So we have to ask the individual how much stigma they feel, how much they've experienced, and how we can actually introduce a sort of coping and support mechanism for them. Now, coping is an important psychological resource. Some individuals may come with an abundance of coping resource, the psychological strength, the hardy personality, the one that really just says, well, I'm just going to crack on with life and get on with it. Or there may be others that don't know how to cope at all. For the first, you're going to need to support them, gently nudge them in the right direction. For the latter, you're going to provide a great deal of individual support and guidance. One of the best forms of support that I can think of, and an added sort of coping resource, is social support. This is the emotional, practical support that you can gain from others. Those others can be family, friends, colleagues, medical and nursing professionals, or organised groups and collectives, churches, self-help groups and the like, for example. Obviously, an individual is not just there in their own rights. They come with a whole range of family relations or networks. Any condition can produce an emotional, practical strain on relationships and on others within that network. That can sort of, because these family relations can be seen as sort of a system, then what happens is that the negative impact can impact on the member of the family. That negative consequence can therefore impact upon the patient, and this vicious circle continues, leading to an isolation of the whole family and the isolation of the whole unit. Medical professionals have to be aware of that. And I think all of this consequently can lead to a redefinition of the self. What does that person feel like? What do they view themselves as? Do they view themselves as a normal person, to use that term? Do they see themselves as a valued individual? How did they define themselves with this new condition? They've got to learn to manage their own symptoms. They've got to learn to manage their treatment. They may have to reorganise their wardrobe, their social connections, their whole daily life. All of these things can lead to a reconstitution of the self. So in psychological terms, this would be biographical work. Again, the individual medical or nursing professional has to be aware of this and has to provide support, whether that be coping, social support, or indeed information. So that information needs to be education about the condition, so proper medical information, but it also needs to be about the psychosocial consequences, how it can impact upon the individual, and how the individual can actually learn to live with that and how they can go forward. So if we put all of this into practice, we need to ensure that the support and education at each stage of the patient journey, from diagnosis through to successful treatment and management. We need to provide prognosis, information and education over prognosis and treatment, ensuring that an individual knows that there's going to be issues with uncertainty, that there'll be fluctuations. We're going to have to provide support for mobility, pain and medical treatments. We're going to need to provide support and direction for coping, and that can include social support, where best to get that from. All the other psychological issues need to be dealt with: body image, stigma, anxiety, and so on. Now, the anxiety and depression are a key, or can be a key feature for certain individuals, of consequence of any medical diagnosis, but that can be particularly important in lymphedema. So the medical and nursing professional should be aware of high levels of anxiety or depression and refer on wherever necessary. However, importantly, and individual psychological factors can be really protective. And so it's important that the nurse, the medic, the allied health profession really builds upon those and helps the individual to support themselves. I hope you found this useful, and I hope you can relate this to some of the individual case studies that you've seen. I thank you, and good evening from Australia.
And we deeply thank Professor Upton, who is indeed from Australia, so we cannot pretend to have him live in the middle of the night, while we are blessed in having today live with us Professor Anna Galaska from Cardiff University. She's an adorable person I met during one of the Lindsay Lake Club activity, and it was already so pleasant brainstorming with her at that time about their knowledge on the sociological aspects of the disease. So we will keep on focusing on the lymphedema aspects with this talk of her, and then we will have the discussion.
Hello everyone and welcome. My name is Anna Galaska and I am a lecturer in Management, Employment and Organisation at Cardiff Business School. I would like to offer a few words that summarize what I learned about specialist lymph therapy. During my PhD in 2016-2017, when I was looking at the development, nature and role of clinician-patient relationships in wound care, I interviewed a lymphedema specialist who was collaborating very closely with wound care clinicians in clinics where I was conducting my ethnographic research. I learned quite a lot from that particular lady about what interaction with patients with lymphedema should look like. And in the short presentation, I would just like to summarize those lessons learned. I learned that the most important skill for a lymph therapist is the ability to be able to communicate with lots of different types of people, to really understand what it is that a specialist can offer to somebody, trying to engage with the person, because it involves talking about something that is a lifelong management skill. It's about making sure that a therapist can understand what it is that really bothers the person, because you can look at a person and think that their problem is the big swollen leg, but it might be, as I learned, that on that big swollen leg a person has perhaps an ulcer that doesn't smell very nice, and actually for that person the thing that is the most important is that ulcer, that smell, and it's that thing that needs to get fixed for them, maybe for themselves, maybe for them this seems to be the most important thing. So communication, as I learned, is very, very important. Being able to negotiate the best way forward, always taking into consideration the progressive nature of the disease, that the person, the individual, might not be able to understand, the importance of nuanced communication about the possible outcomes if they engage with certain recommended treatment plans and management strategies, but also the outcomes if they don't necessarily engage with those recommended treatment strategies, so that people can understand what they are saying yes to, but also so that they can understand what they are saying no to. So what I learned from that lymphedema expert is the importance of taking care for the person, caring for the person, and communicating with them about their condition, communicating with them about lymphedema that they might not necessarily know anything about, communicating with family members who might be involved in care who might not necessarily know anything about lymphedema as equally important. So communication across the board. Communication about the fact that it might be a long-term condition that might require lifelong management rather than a straight-up cure. So talking about the truth, talking about the facts, but also giving that person a sense of hope that things can actually be managed well, that they will learn how to manage it, that they will get better, that it will be possible for them to have a better quality of life at some point in the future. Thank you.
And with this, we deeply thank Professor Anna Galacka, who is with us. And now we go to the vascular experts ward. So I would like, if you like, the idea to have 3-4 minutes dedicated per every continent. And we go in alphabetical order, starting from Africa, which is also good because we stay with the line Egypt, where everything starts. So the idea would be that whoever of this group of experts who are here can write a comment in the chat or take the mic if they have some comments they like to make on what we have listened to. So since we have already, I see Rashad with us in alphabetical order. Rashad, would you like to make a comment?
Yeah, I enjoyed very much listening to those presentations. It's really new to us because we are in the medical profession. We are used to listen only to medical knowledge and medical information. So it's really very useful to listen to another point of view of how patients feel and what's important for patients and what we should deal with. Yeah, I really enjoyed this. Thank you.
And you were so nice to report a patient interview from patients of yours who were actually affected by venous disease. Now we are focusing on the lymphatic aspects. Were you finding yourself in line with what was said by the psychology and sociology expert, or something else to point out in Egyptian patients?
Absolutely. Actually, the patient who was interviewed is with us and listening to us now. No, I'm absolutely in line, and what they said is very important, and we need to be well aware of all what has been pointed out from the social and psychological point of view.
That is great. I see we have also Wasila with us in the audience. Wasila, would you like to make some comments on this?
Yes. Thank you, Sergio. Today, like you said, it's a very special day. It's a typical day dedicated to patients, and this is really very thoughtful and bright idea, which you are never cease to amaze us with bright idea. This time it's so thoughtful, dedicated to patients, which is a beautiful, important opportunity to listen to our patients suffering from venous lymphatic disease. And we have a dear patient among us today. I'm not sure when exactly she will be online and she will get the mic, I'm not sure. But it's very important to highlight here that for my patient, I follow the Caprini quote by Professor Caprini, don't treat an enemy. And since then, I listened to your quote by Professor Caprini. We put a lot of attention to listen our patients and to give a good ear and a good comprehension from their complaints. And actually, it works very well. Thank you, Sergio, for everything. Thank you.
Thanks to all of you. I was checking in the audience for Professor Fakhri, Professor Gawish, and Redman. I cannot see them, so we will move to Asia now. We have again Raul. Of course, we cannot pretend to have our friends from Japan. It's very late over there, and we will check out if we have Professor Padaria with us. I'd like to invite all of you to have a look at the map, as I was saying before, because you will see a lot of these patients' interview and contributions, like this one, for example, from Japan. So we have Raul maybe still with us, if you want to make some comments and point out something you have noticed. For example, I was noticing the fact of the lifelong aspect. Is it something we really want to pass as a message that is a lifelong condition, the one of lymphedema we are focusing over here? What would be your perspective from India?
See, I got in touch with the lymphedema patients like 30 years back, and because I was training in a medical school which was endemic for lymphedema because of filariasis. But you see, in the last few years, what we have found is that the chances of having a lymphedema from filariasis in the country is much lesser. Now we are getting more and more patients with either an idiopathic edema or because of cancer or because of some surgery. And I really agree to both the speakers. These patients are very difficult to treat. And what we have seen in our clinical practice is that we lose these patients on the follow-ups. Or what happens is they don't have the patience. So counseling these patients is very important for a very long-term treatment, because if most of the patients, they don't come early. And if they come late, they normally will continue to have some swelling. And if they don't continue to follow the treatment, then the swelling comes back, in this group of patients. And in India, being a tropical country, being a hot weather, because of the sweat and all, and because lymphedema, mainly what we have seen is in the lower poor socioeconomic status. So these people also get recurrent attacks of cellulitis, and which of course will worsen the lymphedema. So there are a huge number of issues which are associated in our country, especially is the poverty, recurrent cellulitis, resourceful, physicians treating them. Most of the people, they just go for massage and compression, and they don't look into the psychosocial aspect, because which is very, very important.
And absolutely good point, the one of the tropical countries, because in reality, Vein Week started as a project also as a lymphatic week, because globally there is a lot of focus on the infection aspect of the lymphatics, not really considering the fact that it is a hidden epidemic independently also by the secondary cause. So do you think that would be a good thing to try to interact more with the patients for awareness, but also with the institution? That's an easy question, I would say, but even more with the groups of patients, so to have them gathering together in associations, like we have societies of doctors.
Yeah, we try. We have got a group of now nearly 120 lymphedema patients, and but when we give them the invite and all, so not more than 15 to 20 patients turn up at a given point of time. So every year we do that, and we try to get them. But yes, as I mentioned, because this normally happens in the poor socioeconomic status in our country mainly, and now because of the cancer surgery, because of the breast cancer surgery, it's coming up into the middle class and upper class people also. But yes, I think this would be really very good to interact with the groups. We have got a lymphedema society in India, who are doing a very good work in training the people and the patients and the relatives how to manage the lymphedema at home.
That is great. And thank you so much, Raul, again, for all you do. I cannot see Professor Padari. I'm sure he will be connected for answering later on. And then we fly on the way to Europe. I have seen in the audience Professor Shingale. So we can start from Germany with one of the biggest experts in lymphedema in all our world. So Franz, would you like to make some comments? You really are in the front line on this topic.
Of course, just first, thank you so much for that wonderful experience what you showed, and it's very important that the patient can take part. So the big problem is that in Europe, first we had most patients after oncological surgery. Problem is they have to suffer from cancer, and then they got a new disease, that's lymphedema. So very important for psychological treatment on those patients too. Another point, what we have in Germany is growing, that's dependency lymphedema due to obesity. Obesity in Europe is going on more and more. And so this is very important. We have very severe cases of secondary lymphedema. It's not a real lymphedema, it's due to dependency edema due to massive and morbid obesity. So, and here in those cases, psychological treatment is, of course, necessary, and it's one of the main points for the patients. Thank you so much.
A question I'd like to make to you, because for the patients, for example, from all around the world who might not know you, but we all know you, how many of your patients are actually coming in a very advanced stage without having found a previous treatment? Because you see so many.
Yes, so we have the patients in late stages are coming from abroad. Right now we have patients from Algeria, from Tunisia, and we have one patient from Uzbekistan. So they come in very late stages because I think we have to educate the doctors all over the world, especially on compression. Because with compression you can help very, very good, and you can receive very good results after good compression.
Thank you so much, Franz. And now we remain in Germany, because you see we have Professor Oman with us. We will engage, of course, all these panel also in the second part of the webinar that will be more focused on the advanced venous disease, where Professor Homan is one of the guiding lights in our scientific world. But Homan, with all the venous disease you see, do you get the chance, I guess, to see a lot of also lymphatics, because we know that they go together as a family affair, basically?
Yeah, thank you, Sergio, for inviting me to this nice meeting, and thank to Professor Bottini and Professor Shi. The two talks before were very interesting regarding the psychological and psychosocial aspects of these patients. So, of course, in our deep venous center, we have also patients with lymphatic disorders. But Sergio, I would like to comment on all these patients. So I am not going to divide between lymphedema patients and deep venous obstruction patients. I think these are very sensitive group of patients, all venous patients. So learning from two talks and from our daily work, I think it is mandatory to have to give enough attention to these patients and have an adequate communication before doing something. And this is mandatory to stop an overtreatment, especially in the patients with chronic venous obstruction. So, and also a strict follow-up and support, post-interventional support is for me very important and mandatory. So I think we should focus really on this. That was really interesting for me. I learned a lot from these two talks.
Thank you so much. Any update from the German meeting since we are here?
So the German meeting from 8th to 11th of September is the German Society of Phlebology. It is very international, as you know. So you are one of the KOLs there and many other friends. It will be, I hope, a face-to-face in-person Congress in Aachen. So I invite everybody to come, and I hope with a better weather and better rate of vaccination, it will be possible.
Thank you so much. Let's catch up later on. I like at this moment to congratulate the French Society of Phlebology, and in particular the three colleagues you see over here, key opinion leaders from there. I invite you to visit once again the world map on the Vein Week page. They interviewed patients in this nice initiative. Unfortunately, Professor Josnen is in clinical hours, so he cannot be with us. But still in Europe, I've seen we have Professor Olario with us, who is another huge opinion leader of ours. If you are with us, please unmute yourself. I saw him before. Sorry, but there are so many people, of course, that it takes a little while. Thank you so much for all you have done in this Vein Week project.
Thank you, Sergio, for inviting me as panelist on this excellent webinar. And I would like to congratulate the speakers, and I would like to congratulate for this topic. Lymphedema, it's a big therapeutical problem, and also has an important social and psychological impact. It's very difficult to treat this lymphedema, and especially in oncologic patients, where are the scars or where the nodes with compressive effect. I think it's very important, this social aspects, and to communicate with the patient and put together this patient to change the opinion. It's very important, these social aspects.
And indeed, on this aspect, I wanted to have your perspective, since we are neighbors as nations, about the family habits of coming with the patients, so to be instructed, not just for the patients, but also the family. Is it something that you see, or is it something we should work more on, in your opinion?
It's very important also to get instruction and to discuss with the families and to put a good climate in these families.
Thank you so much to all the European top experts. Now we fly to North America. I see we have a huge expert on the field, Andrea Brennan. So if you want to unmute yourself, Andrea, and make a comment.
Hi there. Good morning from Scottsdale, Arizona. The interesting thing that I'm finding is we're talking about treating these patients. And I'd really like to know, in the phlebology world, lymphology world, what are we talking about in terms of treatment? Are we really discussing the phlebology interventions? Or are we talking about actual rehabilitation subsequent to the phlebology intervention? My area of expertise is decongestive lymphatic therapy, which is actually providing rehabilitation to these patients subsequent to their interventions. Or in some cases, some phlebologists send these patients to me to manage their lymphedema or their lymphatic or dynamic overload prior to any intervention. So we manage the edema so that it is a better way in the future for surgery or phlebology intervention to get a positive outcome. So it is a question of how are we rehabilitating these patients? How do we learn, or how do we teach the individual to self-manage? Because in the end, we really have to shift the burden of care from us, the health provider, to the patient. So the role in decongestive lymphatic therapy, which is teaching the individual how to do compression, how to manage their skin care, how to do decongestive exercises, facilitate the calf muscle pump, skin care, and self-decongestive therapy. So it really is a combination of therapy that I look at when we are treating the patients. I am full-time treating these patients, and I have a waiting list of 4 months because the whole goal is to support them biopsychosocially. And if I can switch that burden of care to them and let them be the master of their limb and the nuances of what happens to their limb and how to adjust their self-care, ultimately, they will be able to follow through and take care of it without this chronic or this vicious cycle of returning for care. So that's the role that I play in this whole area, which is the biopsychosocial care. Once the physician has managed the patient, then I will work with them on a one-on-one basis or with the family on how to make them independent and self-sufficient.
I have to say, this is absolutely evidence-based because I've seen this with my eyes watching you working, because I've been blessed in seeing you having a relationship with the patients, for which I think you should really have an honoris causa degree in psychology and sociology as well. So deeply congratulations. And I'd like to congratulate another master I've seen in action, Diane Newhart, family member to me. We talked about our Professor Wasila Tah as our Egyptian ultrasound eyes, because she's a top expert in ultrasound, as well as for Diane as another huge expert in diagnostics. Diane, I would like to ask you the perspective from the diagnostic part. How many failing diagnoses you see in everyday practice? How many patients convinced to be fat rather than having an lymphedema condition, for example? Lymphedema.
Yes, it's a tremendous problem. I'm in Scottsdale as well, and I love seeing Andrea. We're good friends. We haven't been together in probably a year and a half. It's funny, but it's heartbreaking. I've seen so many patients who were told they had lymphedema, and yet they had pelvic obstruction disease, pelvic vein obstruction disease. I mean, misdiagnosis is just rampant, and I'm not. And so I'm really focused on trying to educate individuals to get some help in that aspect. But it's very painful for patients to accept that they have lymphedema or lipedema. And having some of the resources and being empathetic with them is really, our goal. I think for me, mainly, I see a lot of patients with mixed disease, but most of them are just dealing with the fear. And, they come in, they're lay down and they think they have a blood clot, or they, all these things are going through their mind. And so it's nice to have the room kind of dark and just let them relax and really just feel there and empathize with them. You're fine. We're going to manage this, and this is what we're going to do going forward. This is your life. And I like how Andrea said it. We work together in Nicaragua and Ecuador, Sergio and I and Andrea, and she is a dynamo as far as talking to patients. And I think she just brings that, even though she's dynamic, that calmness, the ability to accept, you know, the diagnosis and what is going on. So it's every minute what we deal with.
It was definitely synergistic with what you were doing, so congratulations. I see we have also Professor Mandy Wong with us. Mandy, if you are here and you want to switch on the mic, if not, we can fly all the way to South America, where there is a huge expertise. I have to say that the practical aspects that are demonstrated every day in South America should really lead all of us as experts to fly there and learn a lot of things. Starting from, in this case, Professor Miguel Amore, he is with us. I've seen him before, actually, but not now. But I see that we can go back to Canada because Mandy just switched on the camera. I understand it's a working day, so sorry for hitting the agenda. Mandy, would you like to make some comments on the lymphedema?
Well, I was actually able to review all the presentations, and I think it's really good information. And the best thing that we can do is make, I think, people more aware of the psychosocial consequences of ulcers and lymphedema. I've had a patient recently who has had an ulcer for a year, going to wound clinic twice a week for 7 months, and her ulcer hasn't cleared. And you know, luckily she's had great coping mechanisms, but in Canada even we still see people walking around with huge ulcers because their clinicians don't know what to do with them. And so I think this education is really so vital, and then the multidisciplinary approach is crucial.
That is great. Thank you for your comment. Let's go back now to Latin America. We go in alphabetical order with a huge professional figure, Professor Chantal Aguero. Chantal, I saw you before. You have been tremendous in this Vein Week project. Here you are. I see you. So any comment?
Yes, I think this situation is very important to take care. And of course, every continent have different facts. We have in South America other economical problems. These patients need a lot of support. And I think the best way to manage this is to do prevention. Prevention, talking about communication with the patient, try to find a way to make them feel comfortable with us, and probably we can change a future because, as we say, it's a long life situation. It's not a short one, so we need to keep in touch. And this campaign, this webinar today and during the whole week, we can really communicate a lot of things to the patients, tips that they are important for them, and they can learn from us, and this is important. I think this kind of activities are really important to for the patient to learn from us, know us, and psychological, they can find some relation that they can trust us, and if they trust us, they will follow our direction.
You touched, I think, thanks to you, and I really invite everybody to check on the map of Paraguay because there are very, very interesting Vein Week activities over there. And you touched the point of the prevention and also the physical activity that I think is something we should stress more with our patients. Of course, a proper physical activity, because that's another problem sometimes when they are encouraging doing inappropriate physical activity. We are used to say sport is like a drug. It can be harmful or beneficial based on how you administer that. And then we fly all the way to Argentina because you see we have another giant pillar of the lymphedema world, Professor Bussati, who showed us some very interesting videos about the use of adjustable compression reps. So the question I'll make to you is if you are noticing already a shift in the self-management of these patients. Are patients with lymphedema learning more about self-management thanks to these devices? Or are we still supposed to work more in educating them on these new opportunities that are not even new, I would say?
Bueno, muchísimas gracias en primer término.
You have to speak in the
Sergio,
Spanish
por invitarme a
channel.
participar de este panel de lujo tan enriquecedor para todos nosotros. Desde el año 2011 que nosotros en el Hospital de Clínicas, en el sector de flebología y linfología que está a cargo del doctor Bottini, realizamos protocolos innovadores para el tratamiento de estas afecciones donde es el centro principal la educación del paciente y el automanejo de la enfermedad. Si bien nosotros podemos hacer mucho por nuestros pacientes, ellos día a día en contacto con su afección es muchísimo lo que pueden hacer para mejorar su calidad de vida. Yendo a la pregunta principal que me haces acerca de los dispositivos inelásticos autoajustables con velcro, por supuesto que la curva de aprendizaje es mucho más rápida y mucho más fácil para los pacientes el poder adaptarse a un sistema inelástico autoajustable que realizar un vendaje multicapa que les implica mayor cantidad de elementos y una mayor destreza y habilidad. Pero quiero decirles que los pacientes pueden hacer cosas maravillosas por ellos cuando los entrenamos, cuando le damos el conocimiento apropiado, les acercamos las herramientas para que puedan desarrollarlos y recordemos que somos lo que hacemos repetidamente y que la excelencia no es un acto sino un hábito. Y nuevamente muchas gracias por dejarme participar en este panel de excelencia. Muchísimas gracias.
Thank you so much for the great example you give. And now I see we have also Professor Ernesto Intriago with us, another huge leading figure from Latin America. And I've seen that we have a new date for the Pan American meeting, Ernesto.
Gracias, Sergio, por invitarme a participar. La fecha es para el 21, 22 y 23 de julio del 2022. Realmente he escuchado con atención los avances últimos que ha habido en cuanto a la patología venosa y linfática, pero es importante también darle un apoyo desde el punto de vista psicológico y social a estos pacientes, ya que la enfermedad tanto venosa y linfática es una enfermedad que hay que estarla controlando y los pacientes llegan a incurrir en muchos gastos y en los cuales están involucrados el entorno familiar. Por lo tanto, es importante tener en el equipo multidisciplinarios a todos.
Thank you so much, Ernesto. And now we fly all the way to Brazil. I've seen before Professor Santiago was making some interaction with Professor Galazza. I see that Fabricio is driving. I hope you are pulling over for.
Yes, just right now. I'm sorry about that, but I had to attend a patient with COVID.
Well, it's a patient. It's patient day, so we can talk with you also later on if you want.
So I'd like to address two points to the audience. First, and to the speakers. First, are we psychologically prepared to attend these patients or to give psychological support to these patients? So we have to educate ourselves first to give psychological support to these patients. Are we prepared? Once not everybody has a psychologist on his team. First question. And second, about the role of photographic documentation. As we all know, we have some subjective similarities, interpretation in between timelines. So some of these patients forget about how their legs were before treatment. And some of these patients need an incentive after the treatment so that can see that their improvement was very, very good. So this is something I'd like to address and something that I'd like to point out regarding the psychological aspects of treating these patients.
Thank you so much, Fabricio. And now we focus a little bit more on the other side, so the venous side, that for sure is not really another side because they are communicating channels. And it's my huge honor and pleasure to introduce Penny Upton, a professor from the Canberra University, who will focus on the psychological aspect, and then we will discuss a little bit more.
Hi, everybody. So I'm Dr. Penny Upton. I'm an Associate Professor at the University of Canberra in Australia, and I'm really pleased to be with you today, even if it is virtually. I'm just going to spend a few minutes talking about the sort of psychological consequences of living with venous ulcer and what we can do about that, how we can address that in a clinical setting. So it's pretty obvious to everybody that somebody with a venous ulcer has a clear physical problem. They may have a lot of pain. They will perhaps experience exudate and odor, and they're going to be undergoing some treatment as well. And the treatment itself might be quite painful too. So all of these experiences of living with a wound tend to result in a very specific set of psychological consequences. And we tend to see similar sorts of consequences throughout cultures, although the manifestation of those experiences might be slightly different. But what we tend to see is that people will have problems with depression and anxiety, so their mood will be affected because of the experience of having the wound and the treatment and all the other things associated with having that wound. They might feel that they're being stigmatized because they may be very aware of the dressing that they have. It may mean that they have to wear different clothing to cover that dressing up. They may also think that other people can smell their wound, or that other people know that they've got this lesion. And that can really affect your body image as well as making you feel down and depressed. And what we often see is, well, whether there is actual real stigma or not, or whether people just think that others are treating them differently, this kind of feelings can lead to people actually withdrawing from others and spending more time alone, so they become isolated. It may also be that other people spend less time with them because they think that person wants to be left alone, doesn't want to be bothered. And altogether, all these sorts of things that you see happening can really impact on somebody's sense of self, and they start to feel as if they're not who they usually are. They start to feel very different, and that can be quite a difficult thing to cope with. And I don't think we should ever underestimate the problems of that kind of experience. Now, what's interesting, however, is that even that people with very similar kinds of wounds and very similar severity of ulcer will experience all these things differently, and some people will be more affected by the psychological consequences than others. And the reason for this is, we think, the fact that everybody has some protected personal resources, and some people have more of those resources than others. Now, there are all sorts of things like people's ability to cope with having a wound, and we find that people who are active copers do much better. People who seem to be quite resilient and positive in their outlook, so they're very strengths-based, they have hope and optimism for the future. And also we find people who've got good social support networks around them, whether that's friends or relatives or even the healthcare professionals as well. There's also an indication that sometimes people's personality might influence how they cope with having an ulcer and the sort of psychological problems that they might have. And we know that personality, it's not to do with having a specific personality trait, but actually people who are less neurotic, so they're less emotionally affected by things, tend to do better. So what can we do as clinicians? How can we make sure that people who have ulcers still manage to cope psychologically as well as physically? Well, what I should do, since we haven't got very much time to address this, I'm going to say it's really important that as a clinician, you have to address the psychosocial aspects of living with a venous wound. You have to try and bolster those personal resources I've just talked about, instill resilience in people, support them to be less neurotic and more conscientious, because we know people who have more traits of conscientiousness tend to do better. And to do that, it means you have to be very aware of their psychosocial well-being as well as their physical health. And obviously you can, in a clinical setting, ask people how they are, but we know that when you ask someone, how are you today, they tend to give the standard response of, I'm okay, even if we know they probably aren't. And if you really want to assess their psychological health, you need to use a sort of standardized measure, what we call a patient-reported outcome measure, because these measure the dimensions of health that only patients can really know. And it's really important that you choose the right one as well, so that you're measuring not just the problems that people are having, but also the resources they have. So you have that balanced view of what's happening in their life and how they're going to be able to cope. And so to give you an example, as I say, you want something that's going to be measuring the positives and the psychological resources, as well as those difficulties that people are having. And this is just one example of the kind of measure you might want to look at, which is something we developed a few years ago and does tap into both of those matters. And if you do that, it puts you in a good place to really manage strengths-based, holistic, person-centered care for the individual with a venous wound. And it's really important that you're providing hope for that person, but also being realistic and honest, but not just leaving them hanging, if you like, and saying, well, I'm sorry, you're just going to have to live with it, there's nothing we can do, but actually trying to reframe their thinking around things and help them find positive ways forward, and to be independent and take control of their health care. And the really good way to do that is obviously collaborating with the person as you're planning their treatment, and also focusing on what they can do. So rather than taking that deficit approach of, oh, you're not going to be able to do this ever again, is think, what are the positives that you can find in their situation? What can they do either alone or with others? And I think celebrating successes and encouraging those positive feelings of self-efficacy, of I can do, are going to be really important for people. And if you're able to do that in a clinical setting, then I think you're going to be in a really good situation to address those psychological and social issues, as well as the physical issues of living with a venous ulcer. Thank you.
With this, we deeply thank Professor Upton. I think she touched very important topics. So we go back to Anna Galacka, who is still with us, I think, for looking now at the aspects of sociology, again, in the venous ulcer world this time.
Hello and welcome. My name is Anna Galacka and I am a lecturer at Cardiff Business School. In this short presentation, I would like us all to think a bit more about the interview that Ellie Lindsay conducted with Anne. And in this interview, Anne was speaking of how long it took her to get a diagnosis of her condition. Anne said that her GP wasn't initially very interested in her condition, that the consultant that she went to see at the time wasn't able to recommend a treatment that would work, recommending Vaseline instead. It was not until Anne went to see an expert that she finally got her diagnosis. And Anne also spoke about similar experiences that other people went through. She told us about stories of other patients who also needed to go through a rather lengthy process of referrals before they got their diagnosis. She also spoke about the importance of increasing the overall level of understanding and awareness of wounds and wound care. What strikes me as somebody who looked at wounds and wound care through a sociological lens is the development of wound care as a specialism, as a profession, and the implications of this professionalization for the presence of basic wound care skills amongst non-specialists. Unpacking this relationship needs a look back to the 1970s and 1980s. In the 1970s, wound care was part of general nursing curriculum, but since then, of course, both nursing and wound care have progressed, have developed, have gone through their own professionalization projects. This has been an important step, of course, because both wound care and nursing have developed. And it has been an important step because there is definitely still a need to improve the understanding of wounds and wound healing in patients, to raise the standards of wound care provision, to show that wounds are an important part of the clinical problems and an important clinical problem that has a very strong place in clinical practice. In sociology of health and illness in the 1970s and 1980s, there was a lot of talk about professionalization through clinical jurisdiction. Healthcare professionals aiming for the status of a medical profession, having unique control over a particular field of healthcare and expertise in this particular field of healthcare, almost an autonomy to practice this particular type of healthcare provision. But of course, there is a risk that professionalization, which is based on competition rather than collaboration, can exclude healthcare professionals who are not specialists from having a good general level of knowledge, understanding, and basic skills in the field. I have included on this slide a quote from a research nurse. It's from an interview that I conducted as part of my doctoral research into the relationship between clinicians and patients in wound care. And I wanted to include it because I think it encapsulates that problem of professionalization based on clinical exclusive jurisdiction and the ways out of it. The research nurse says here that she had a lecturer once who said, "I don't like specialist nurses because they take knowledge away from generalist nurses." And I said, "I am not a specialist nurse, I am a research nurse in wound healing." At the time, I was 1, a bit annoyed about what she said, and 2, a bit taken aback that she should think so. I now know what she meant. The generic nurse who is so busy doing so many different things in primary care or secondary care, but I understand that having specialist nurses makes the generic nurses rely more on the specialist nurse. But I also think that specialist nurses can roll out education just by being there. You don't take over, you have to bring the generic nurse in with you to do something. Show them what to do, what they need to do. Fortunately, there have been significant changes in the medical profession's work since the 1970s, since the 1980s. It's necessary to ensure that part of the move towards improved diagnosis and improved treatment and improved aftercare, of which both Anne and Ellie spoke, comes with a multidisciplinary collaboration and the creation of educational pathways for all, so that all sorts of clinicians, all types of clinicians, GPs included of course, have got a strong level of basic wound care to improve wound care practice for patients. Thank you.
And with this, we deeply thank Professor Anna Galatska. We move forward. And indeed, I'd like at this point to deeply thank all the top experts from all the continents, reminding you that for the sake of time, you can make questions in the chat so that all the audience can see your comment and point of views, and we will report them in the website. So one by one, I'd like to deeply thank Professor Bishara, Professor Fakhri, Professor Gawish, Professor Redman, Professor Taha from Africa, Professor Jindali, Mai, Mo, Yamaki, and Professor Padaria from Asia. And then from Europe, Professor Oman, Professor Josnen, Olario, Rial, and Professor Shingale. North America, Professor Brennan and Professor Newhart, Serralde, Pittman, Wong, and Professor Amore for all the teamwork with the International Society of Lymphology, Professor Aguero, Professor Bussati, Professor Intriago, and Professor Santiago. I remind the audience that you can still make questions in the chat, and all these experts I've just named and deeply thanked are at your disposal for the next 20 minutes. Now we'd like to introduce Lorena Grillo, a pillar of all our activities, a dear friend, a huge expert, who is serving now as a keynote for delivering a talk, again, to the population about the things everybody should know in terms of epidemiology. Lorena, would you like to go live, or would you prefer to play the video at this point?
Let's do the video because of time.
Okay,
frame.
we are ready for that. Thank you so much. Go.
Greetings to all. My name is Dr. Lorena Grillo from Costa Rica, and I'm going to give you some venous lymphatic data for you. So I want you to know that 50% of the patients will be having to deal with venous disease. And what does that mean actually? You know, you're going to be having a possibility of having at least 10.4% of work days lost, which is a harsh reality nowadays. And also, it's one of the diseases in which we have the first preventable cause of death. And actually, this is all about strategy because we work so hard to build up everything. And one of the most important things is being healthy. So we want you to have healthy lives, healthy days, and also have quality of life during your day and during your work days also. And this is the classification we use in order to see how advanced is your disease. And this is like a ladder, and I'm going to share this actually a very nice slide from Dr. Giannesini, in which first we have spider veins, then we have another ones that are like a little bit more dark, are reticular veins, then we have varicose veins, then we have changes of the skin, discoloration, pigmentation, and maybe some harder skin that you can see in your legs as the chronic venous disease advances. And eventually we have patients that already had an ulcer and it's already healed, and this is like the 5th step. And then in the last step, which is the 6th ladder, it's when you have an active venous ulcer. So we want you to prevent to go up this ladder. So remember, don't climb this ladder. And we have to get some things very clear in your brains. And it's not only what you see, like the spider veins and the varicose veins, but we could also have clots in these varicose veins, which we call superficial thrombophlebitis. Or we could have clots in the veins that are deep within the muscles, are deep vein thrombosis. Eventually, there's a big burden with leg ulcers for patients. Even if about 2% of the patients have it, around that 55% of the patients, it will be a venous cause that will have to do with it. So it's very important to be able to teach you some things about it and for you to apply some of the things you learned today. And also lymphedema, which is not very known, but it usually affects one limb rather than the 2 of them. And it also has this sequence of advancement and progression of the disease. And so we have risk factors. So there are some that we can't modify and others that we can. So age is non-modifiable, gender, but we can try to modify weight so that we don't have to be obese. We can have a better physical activity. If you smoke, stop doing it. Try to have less intake of hormones, just use if necessary or otherwise needed. Control your hypertension, be preventive of leg injuries, so eventually you don't have to undergo the possibility of not healing. And so you can have complications also. You could have bleeding, and we first want you to do compression on that, and then go to your doctor. If you have phlebitis, which already said this, the vein is occupied by thrombus or a clot, then you want to do some compression. Afterwards, you have been treated and evaluated by your doctor. And when you have a leg ulcer, we will also use compression in order you to prevent and take care of the cause of this problem and aid you to heal. So prevention definitely is the best treatment. And we want to be aware that this disease exists, and it eventually could affect your economy because you will have to lose some days of work or not be able to be as healthy as you want. But it also depends on the adherence that you have of all the indications that we give you. So we want you and I to reach the goal that is to make you have a better quality of life. Thank you.
And with this, we deeply thank, as always, Dr. Grillo, and now we go to our patients, because indeed they are the protagonists of today. So we have some reports from representatives of the patients. It's my huge honor and pleasure to introduce Anna Maisetti. You might remember her. She was with us during the Food for Veins project, a wonderful person, really advocating for public health, and she also wrote a very interesting very interesting textbook about lymphedema that I really encourage you to read, because it's also in English, up to my knowledge, and in other languages. Here her message. I have to go in Italian, so if the simultaneous translation can assist me. Passo all'italiano.
Ciao a tutti dall'Italia, sono Anna Maisetti, una paziente con linfedema secondario alla gamba destra. Voglio ringraziare il professor Sergio Gianesini per questo gradito invito che mi onora nel partecipare con un ruolo attivo ad una giornata così importante. Grazie anche a tutte le persone, i professionisti, i pazienti collegati da ogni parte del mondo per creare una rete per aumentare consapevolezza e quindi generare informazione in merito alle patologie che colpiscono il sistema venoso e linfatico. Io sono una paziente attiva sui social, ho una community che si chiama Stile Compresso in Instagram che conta più di 10.000 persone, quindi ogni giorno verifico e mi rendo conto di quanto un'informazione poco corretta e non su basi scientifiche possa essere pericolosa. Noi pazienti abbiamo bisogno di un'informazione semplice, con un linguaggio estremamente chiaro, che ci possa aiutare anche ad avere delle informazioni basiche, per poter poi rivolgerci a dei professionisti, specialmente quando si tratta di patologie nella generalità ancora poco conosciute e riconosciute. Quindi grazie per questo importante convegno internazionale in cui anche i pazienti possono accedere, possono ascoltare ed intervenire con un ruolo attivo. Spero di potervi incontrare il prossimo anno di persona, ma per ora vi mando un grande bacio e un grande incoraggiamento virtuale. Never give up!
Ringrazio tantissimo Anna, continuo a parlare in italiano perché passiamo un'altra testimonianza di una cara amica, tra l'altro presentata dal professor Campisi, che ringrazio per la sua attenzione sempre alla consapevolezza sul linfedema, con la giornata del 6 marzo per l'appunto dedicata al topic. E qui c'è la sua testimonianza.
Buongiorno, mi chiamo Silvia, sono una paziente affetta da linfedema primario che opera nel mondo del terzo settore, ossia delle organizzazioni no profit. In questi anni da Boccas ho avuto la possibilità di confrontarmi con pazienti, ma anche famiglia di pazienti affetti da linfedemi in forma pura, in forma combinata, pazienti che presentano incomorbilità e altre patologie rare o croniche. Ho avuto la possibilità di ascoltare la narrazione dei loro vissuti caratterizzati da sofferenza, da dolore, da carichi di stress emotivo molto impattanti che deteriorano non solo la qualità della vita del paziente ma di tutto il suo nucleo familiare. Queste storie sono diverse, ma da esse emerge con evidenza come per il sistema famiglia sia di fondamentale importanza poter interagire all'interno di una rete non solo multispecialistica di operatori sanitari ma anche multiprofessionale, in cui siano presenti professionisti delle scienze umane, delle scienze sociali e in cui è di primaria importanza, con un ruolo cardine, la presenza dello psicologo, spesso assente o presente con un ruolo minoritario o marginale. A mio parere lo psicologo è una figura fondamentale in questa rete multidisciplinare in quanto funge da ponte che mette in connessione due sistemi, il sistema della famiglia da un lato e il sistema degli esperti dall'altro, che devono necessariamente parlarsi affinché vi sia aderenza terapeutica e affinché vi sia continuità terapeutica non solo nel breve ma anche nel medio-lungo periodo. In questo contesto lo psicologo può favorire le comunicazioni ma anche le relazioni che si devono venire a creare tra i pazienti, le famiglie e gli esperti. Comunicazioni che devono essere basate su un linguaggio comprensibile che utilizza delle parole che gli esperti di saggistica di etica medica definiscono parole non malate, parole oneste, parole rispettose pronunciate con delicatezza. Inoltre, affinché i rapporti tra medico e paziente e medico familiare dei pazienti possano perdurare nel tempo, è fondamentale che siano basati sul rispetto e sulla fiducia. Se viene meno la fiducia, le relazioni si deteriorano e nel breve periodo, in alcuni casi, ma molto più frequentemente nel medio-lungo termine, la continuità terapeutica viene meno. Questo sottoporrebbe il paziente, ma anche la sua famiglia, ad un ulteriore carico di stress emotivo che si può trasformare anche in altri disturbi molto più complessi di natura psicologica. Quindi è fondamentale che lo psicologo sia presente per aiutare a sostenere a livello emotivo, ma anche a livello psicoeducativo, tutti i membri della famiglia, affinché all'interno del nucleo familiare si costruiscano, se assenti e permangano nel tempo, delle conversazioni amorevoli basate sul rispetto e sulla comprensione, conversazioni non contrastanti, che porterebbero il paziente a sentirsi non compreso, abbandonato anche dai propri cari. Grazie.
Con questo passo di nuovo all'inglese. To deeply thank once again Anna and Silvia. We hoped with this contribution to point out the importance of gathering together also of the patients in groups that are looking for evidence-based data and proper advocacy, pointing out also the role of the family, as we have said multiple times during this webinar. Now, the very beautiful part, I think, of this group effort was reaching out to patients from all around the world. So I'd like to ask Ellie Lindsay to introduce a patient from UK.
Thank you, Sergio. It gives me great pleasure to introduce Mary Rose Foulkes, who is a great advocate for patient rights, but also the psychosocial approach to lower limb disease. And she has personally experienced not only from a volunteer role, but also from a patient role. Mary Rose Foulkes.
Do we have Mary with us? I've seen her before. I don't see her. Is she here?
Yes. Can
Okay.
you hear me now?
Yes, we can.
Good. It is wonderful to have this chance to tell people of the Lindsay Leg Club and what it does for the patients and how much it helps them and how much encouragement they give to the patients. It was about 30 years ago that I was in a car crash and my left leg was very badly injured. It swelled up in the warm weather, but I lived with it. And at the age of 68, a few years later, my right leg was badly cut on a car door, just below the calf muscle. It smelt, it was sore, it was horrible. I felt very embarrassed at trying to see people and to do things. And I went to my doctor, who then said, well, you could go to the leg club if you like. And I didn't really have it explained to me, but I was so pleased to attend. It had become ulcerated, waiting for something to happen. And the future had looked very, very poor. This also, apart from being embarrassing, painful, uncomfortable, it didn't help me with my voluntary work, but being a nurse, I did help with the local hospice. And of course, I could no longer do that. Then, like the American Cavalry in the films, Lindsay Leg Club came to my rescue. The treatment by the Lindsay Leg Club was welcoming, warm, friendly. It was a club atmosphere. They really wanted to help me. They gave me a Doppler test to see how my circulation was working. And both legs were put into pressure bandages. And okay, they were a little bit uncomfortable at the beginning, but eventually you get used to them. And 8 weeks later, salvation. The ulcerated legs had healed. The people at the club listened to me. They comforted me. They had time for me. And they took the fear away. Support stockings were fitted to maintain the progress. Now I had 2 new good legs again. Alleluia. A bright future, thanks to the Lindsay Leg Club.
Thank you so much, Mary. And now we fly all the way to Egypt. We are used to say where everything starts, but in this case, it will be where everything ends, because it will be the end of the webinar, but we will end with the grand finale. Thanks to Professor Wasila Taha, who will introduce us a new friend. Wasila, unmute yourself.
All right. Yes, Sergio, it's truly a very special day, a typical day, and was really awesome to listen to all these great talks dedicated to patients and how to deal with great attention to their clinical as well as psychological aspects. And now a huge pleasure to introduce my patient, Mrs. Parihan Afifi, who is the best perfect example to the quote by Professor Caprini, don't treat an enemy. Actually, Mrs. Parihan is a true friend. Actually, her husband is a dear medical classmate. So you can imagine how many medical consultations she did seek before landing in our clinic. Now I leave the floor to Mrs. Parihan. Pari, please unmute yourself.
I did, thank you. Before I start, I would like to really thank you for inviting me, because it really was...
Maybe you are not in the English channel, Parihan. Please check to be...
No, I am. I guess I am. I guess I am in the English channel.
On off, maybe off, not in
the mic?
English?
I'll check. No, I am on the English
channel.
channel.
We can hear you. Now we can hear you.
Okay, thank you.
Okay. So be sure you're in the English channel and you muted the original audio.
Yeah, okay. Now you can hear me?
No, you have English and then original mute audio.
Is it okay now?
Yeah, we can proceed. Just okay. Go on. Yeah.
Okay. First, I'd like to thank you also
No.
This is really. Let me try this. How about this? Like this? Okay.
Okay.
You hear me?
Yes.
Okay. Then I would love to thank you. It was very informative for me, really. And I would like just to share a little my story, which is I've had for the last 15 years, I've always had problems with my legs, with my veins. And then 7 years ago, I had an operation. It was very painful in my left leg, during which the doctors had to block one of the veins. And last year, and with my responsibilities and all, my right leg started swelling, and it kept on going, and until it reached a point of inflation. I couldn't bear it, and I couldn't walk. And even my regular compression sock, I couldn't put it on. It was so inflated. That is when I turned to my doctor, and she recommended the use of adjustable compression wrap. At first, I thought it's complicated, and I needed assistance to put it on. But really, later on, I managed it very well, and it became very easy. And really surprisingly, 2 weeks later, the swelling started and the pain, they both started to decrease, and I was able to move freely again. What is unique about this wrap really is that I can apply the whole pressure everywhere at all points, the same pressure. And also, the less the swelling became, the more I was able to increase the tension. And thus, my leg felt really better. don't know what would have been without.
No problem, Perianne. We understood the original concept. We invite you to write your personal perspective in the chat so we can all enjoy it. And since it's 8:30 p.m., I'm sorry, but in Italy it's spaghetti time and we have to run to the dinner. So let me just move forward. I don't know if we have the opportunity of having with us in the conclusion of this Italian webinar an Argentinian family member. We are used to say Argentinians are Italians speaking Spanish. So I hope that either Roberto or Oscar are with us in this moment. Is there someone from Argentina? I don't see Oscar, maybe he's in clinical hours. So we will move forward. I'm sure they are with the patients. And indeed, this is the topic of the day. As I said, it's a spaghetti time. It would be time to gather together on a social dinner. Let's hope very soon, but we know that in reality, the road will be still quite long. So let's be patient and keep on with the virtual world. That does not mean in its difficulty of this time that it is not providing also the opportunity of gathering together, in this case also with the patients. We touched some topics I think are really in line with our mission for the Winter 2022 meeting at the Expo Dubai. I like to point out to the patients that it has been reported that 40% of the medical websites are including fake news, shared in average 450,000 times. For this, thanks to the collaborations of many colleagues from many different organizations around the world, we are inviting you to report eventually encountered fake news. We are talking, for example, about the importance of compression, but it has to be a certified compression. There has to be a proper prescription of specialists, not whatever compression, of course. This will be reported in a consensus document of top experts that will be indeed presented during the Expo, where I hope we will land all together. I remind to our colleagues, health professionals, that everybody can become a developer by applying in this form and develop activities in their own region. I'd like to take this chance to deeply thank the ones involved in this really atypical, but I hope a fruitful meeting that was indeed quite stressful in the organization, but we had no concerns because we have behind us Khaled, who is always a guarantee and safety in this new initiatives. The next initiative will be more in line with our scientific usual gatherings. It will be on Friday, and this will be dedicated to the multi-specialty approach to the venous and lymphatic disease, for which we will be honored in having also representations of the boards of the World Society of Orthopedics and also of OBGYN. Nothing would have been possible without the unconditional support of Alpha Sigma, Medi, and Philips, so I'd like to deeply thank once again. And I'd like to deeply thank a brotherly friend who performed a wonderful webinar today in Georgia, but not only, he performed an amazing educational video that we like to honor and celebrate as final message of this webinar. this was in honor of Professor Zaza Lazarashvili and all the Georgian friends who developed this wonderful initiative. We really liked it because it's a coach, and we are used to say that it's not just where you go, but also who you are traveling with. And it has been a wonderful virtual trip also today, thanks to you. And break a leg, but not against all the initiatives who are still running around the world during the Vein Week. Thank you so much. Thanks to all the patients. Thanks to all the wonderful experts. Have a nice day, evening, or morning. Ciao.